This is to speak about the role of HIFU in liver and pancreatic tumors and maybe have some ideas for the future. So it's a great pleasure to speak. Let me just get rid of this lot. Hang on. Okay, so anybody if you're ever in Oxford, you're very welcome here. And we would love to show you our department and our unit. So many people will have heard of William Osler. He was a Canadian who was one of the founding fathers of the Johns Hopkins Hospital in the United States, and he ended up as the Regius Professor of Medicine in Oxford. And he is reputed to have said diseases that harm require treatments that harm less, which is very appropriate for HIFU. And Mencius in China said something similar, that compassion for fellows is a matter of the heart, and righteousness is the path. But of course, surgery has come a long way from open surgery, which is what I spent most of my life doing, big complicated renal surgery, sometimes going up into the heart, to the laparoscopic, to my colleagues who are doing robotic surgery. And I say that I moved from open surgery, and I missed laparoscopic and I missed robotic, and have gone straight to non-invasive. And here again is William Osler in Oxford, standing in his room. He died in 1919. And we were privileged to have Professor Zhang Langling and Professor Lang from the Chinese Medical Association of Obstetricians and Gynecologists in Oxford. And in fact, in 2017, the Chinese Osler Society was founded in Oxford, but is in China now. And Gail Tahar and I had the privilege of going to Tibet a number of years ago, and we saw this, which was very interesting. So this is like the HIFU principle, of course. Sorry, let me just go back. So this is how they boil kettles in Tibet, but using a similar principle to HIFU. Gail and I had a good time there. And many of you will know this paper, which really is the first one that talked about sound being useful and the effects of high frequency sound waves in 1927. And some of you may know Tintin, and I saw this book in the Calculus Affair where it talked about the power of sound crushing and breaking windows. And of course, we know everybody who works with HIFU knows about the Fry brothers, an interesting name, but the two brothers who really started HIFU work in the 1940s, looking at Parkinson's disease, but they had to open the brain to treat. And then, of course, the drug treatment for Parkinson's overtook that. And this is a rat liver, Gail Tahar showed, and the power of HIFU in just making a hole here in rat liver. And Gail, of course, certainly in this country was one of the, well, worldwide has been one of the leading physicists working on HIFU over many years. And here is a setup that she made in the Royal Marsden in 1996 to treat liver cancer. This was made by her. So this was one of the very early treatments of liver cancer. And in China, as many of you will know, it started in 1997 and the approval came in 1999. Well, in Oxford, we have had contacts with the Chongqing HIFU for the last 20 years. I first went out there in 1999. And this was the purpose-built unit that we had in Oxford in early 2000s, the first purpose-built HIFU unit, I believe, in the Western world, even though it looks as if it's just a fairly small shed. And we had this machine, the JC200 machine. And now, although this, and here is the HIFU center in Chongqing in China, and in Oxford now we have this, the JC200 machine. And this was the first patient who had metastatic liver cancer who was ever treated, I believe, in Europe, certainly with the Chongqing JC machine. She died soon afterwards, but she allowed us, she had multiple mets in the liver, but she allowed us to treat one of her liver tumors, which we then removed post-mortem and saw the effectiveness. And this is the team that we had in the early days: Professor Feng Wu, that many of you will know, David Wild, three of my research fellows, and Val Berry, who is our administrator. So you've seen this. This is, of course, what we are using with a focal length of 12 to 14 centimeters, targeting the liver. And this is a piece of ox liver that Gail Tahar showed me with, as you know, a very fine, very sharp margin of about 6 cells thick between the non-treated liver and the treated liver. So very, very precise. And indeed, as you can see, every time you fire it, you get one of these little things, and how precise it can be in the middle of a block of ox liver that this was used, and just painting out the tumors like this. We've treated quite a lot of things over the years, mainly in clinical trials, but I'm just talking about liver and pancreas today, with some ideas for the future. And this was the paper that we wrote in 2005 in the British Journal of Cancer, looking at the safety and feasibility of HIFU for the treatment of liver, and we looked at kidneys in a Western population, looking primarily at the safety and toxicity, and then secondarily at the performance. And we had 56 patients. In the liver tumors, we had 28 that were treated non-surgically, and then we looked at them radiologically. We had 7 treated surgically that then subsequently had the liver resected, and we looked at histology, similar for the kidney. And these actually were the kidney patients that we treated. And the problem with kidney, unlike liver, is the perinephric fat around the kidney absorbs the HIFU, so it makes it less effective. But anyway, as a result of that, we managed to get the machine CE marked by the European Community for treating liver and kidney tumors, and it's more recently been extended to include all abdominal tumors. And here's James Kennedy, who was one of my first research fellow who set up the whole scheme with me, who now has changed direction and is actually a priest, is the vicar of a nearby church up in Chipping Norton. But it was really James who was responsible through his PhD work in setting up the major link with China and in getting the JC machine approved for use in the Western world, in Europe. He remains a good friend. He remains very interested in what's happening with HIFU, and he's just a few miles north in Oxford. So that was the ablation of the livers. And then a current radiological fellow who's just completing his training did his DPhil on this, which was targeted drug delivery for liver tumors, which is very interesting. So using a focused ultrasound to release doxorubicin, and basically you take doxorubicin, a cytotoxic agent, and you put it into thermosensitive liposomes. These are a little bit like butter. They are stable at 37 degrees centigrade, but they break open at 42 degrees centigrade. So here we are, just that small range. So you get drug release when the temperature hits 42 degrees centigrade, and so you can get basically a very high concentration in a tumor if you manage to heat the tumor up to 42 degrees centigrade. So what my colleague Paul Lyon and Konstantin Kousios, who's Professor of Biomedical Engineering in Oxford, did was took patients who had metastatic liver cancer, and you put a slightly non-focused beam, HIFU beam, over the tumor so that you are heating the tumor up to 42 degrees centigrade. And then here, so here, for example, is a tumor in the liver. You take a biopsy of it just to show that it is a malignant tumor, mainly secondaries from colorectal cancer. And then we induce thermodox peripherally into the vein, and then you heat up this particular area, the tumor, to 42 degrees centigrade. And then as the liposomes pass through, they break open and you get targeted drug delivery. So here's the baseline before tumor delivery. Here's where we were heating it up with the ultrasound. And then you see a much increased damage to the tumor, more so than just ordinary drug delivery at 2 weeks and at 4 weeks. And we had 9 patients with complete radiological assessment, and most of those showed significant increase in drug delivery to the tumor with good results. And this was the first study done in man of that, and it was written up in the Lancet Oncology in 2018. So what about pancreatic cancer? We do not have the experience of pancreatic cancer at the moment that Professor Holger Strunk has, but we have treated a few patients and we have some trials ongoing at the moment. So again, we have 2 trials. This is my colleague Paul Lyon, who's a very bright young clinician who did his DPhil on the targeted drug delivery for the liver. And as far as pancreas goes, Professor Wu, who's with us, treated in China 8 people with unresectable pancreatic cancer with, again, mainly for pain relief. And you can see the effects here. It's not quite so easy to see with the pancreas, but there is lack of uptake after treatment, and did again put some stents in and treat patients with stents in, and again for palliative treatment. I think this image is reversed because the pancreas is normally on the left-hand side, of course. But and we treated, in the early days, we treated 1 patient in Oxford for pain with a good result and relief of the pain. And we are now starting both an ablation trial of pancreatic cancer and also, similar to the liver's, targeted drug delivery for pancreatic tumors. So what about the future? Be interesting to see what my colleagues think about this, but I think the machines are going to get smaller, the treatment will get faster, the imaging will get better. And one of the interesting things that we are going to look at with the pancreas is, which I think is very exciting, is the possible immunological studies, and whether certainly if you have the cavitation and you're breaking up the cells, whether if you release some of the antigens, whether you may get anti-tumor antibodies, and if you do, whether that could possibly have an effect on metastatic disease. I don't know if anybody knows the ongoing work with this, but certainly some time ago in Lyon in France, they were looking at endoscopic probes, and it may be that some of HIFU on endoscopic probes may have a place. This is also interesting. Some people may have heard of Eleanor Stride, who worked with Gail Tahar, a very bright research scientist who's working in Oxford, just running this research centre called Botna-3, and she is interested in HIFU and is looking at the possibility of targeted antibiotic delivery in the same way that you can do targeted drug delivery for deep joint infections that are difficult to treat. This is a colleague of mine, Peter Ratcliffe, who won the Nobel Prize for Medicine with 2 others in 1919 for his work on how cells sense and respond to oxygen. And maybe in the future we will be looking at prevention rather than cure, but I think as long as we're looking at cure, HIFU is going to have a very bright future. And also especially possibly due to COVID, when of course you're not making any incisions, and for a lot of these things you do not need theatre time, even if you need anaesthetic time and sedation. So I'll stop sharing there, and thank you very much, and happy to answer any questions now or perhaps later on.
Yep. Are there any questions? I don't see any hand